This is chapter 4 in the patient care book, which is about critical thinking and problem-solving strategies. This is out of your patient care 7th edition, and it starts on page 30. So this whole chapter is kind of interesting because it's kind of odd to think that you have to actually teach critical thinking and problem-solving strategies. People pretty much critically think and problem solve every day. If you think about it, you know, if you get up in the morning and you're heading out the door to work or to school or to the grocery store and your car doesn't start, you don't just go back inside and say, I can't do anything about it, my car doesn't start. You have to critically think and problem solve about how you're going to get wherever you need to be, whether you have to call someone to come fix your car or ask someone else for a ride or take a different vehicle. You don't just give up and say, oh, I can't do it because that doesn't work. You think through the situation and you problem solve to get your goal still accomplished, even though things didn't pan out the way you expected. And with allied health, it's the same kind of thing. Like ideally, every patient would be walkie-talkie, ambulatory, eager to listen, eager to follow your directions and do exactly what you needed them to do, but that's not always the case. You're not able to have a perfect patient every single time, so you have to critically think and problem solve your way through the situation and still come up with a diagnostic image for the patient that can be interpreted by the radiologist. So this chapter just kind of focuses on some different things that you can do from the medical standpoint as far as critically thinking and problem solving. When we look at the objectives for this chapter, they reference that you have to define critical thinking and problem solving, discuss the importance of critical thinking and problem solving in radiologic sciences, describe the role of critical thinking in a clinical, an ethical, and a technical decision making, use the steps involved in problem solving, and apply teamwork and self-reflection in critical thinking and problem solving. That's probably an important one. Teamwork is important, but reflecting, self-reflecting on what you did to see if that situation arose in the future, would you do things the same way or would you approach it differently based on the outcomes that you achieved? The rest of the objectives are to analyze and determine the appropriate actions for the situations that require critical thinking, professional situations that use critical thinking and problem-solving skills, and develop critical thinking and problem-solving skills as a radiologic science professional. That's something that kind of comes with time in the field. As a student, you typically won't have the biggest base of knowledge to draw from with that unless you work in the medical field currently. But when you're out on clinical and you're following the technologist, working with the different technologists, you kind of pick up on things that they do. You inquire their reasoning. How did they come about with that decision that they did, or how did they learn that, or where did they come up with that? And you kind of take a little bit of what they do and you kind of make it your own. And ideally what you're doing is building like a file system so that when you encounter different situations in the future, you have something to reflect on and use from your own personal experience. But in the beginning, you don't really have that personal experience, so you tend to go on the experience of the mentors that you work with, whether they're radiologic technologists or radiologists, things like that. But the benefit of being a student is also that sometimes you guys come up with really awesome ideas that people who have been in the field for a while don't really think about, or we tend to get stuck in doing things the same way that we've always done them because that's just what we've always done. And sometimes students can give a fresh new perspective on things and come up with different ways to do things that are different, unique, and that they actually work. So that is a perk to being a student and not always having all the answers. Sometimes you come up with really awesome ideas on your own because you don't know what is typically done. And sometimes what is typically done isn't always the best way or the most productive way or necessarily, what needs to be in that situation. So don't discount the fact that you're a student. That's a good thing, but you also want to learn and gain knowledge from those that you work with, your peers and your mentors. When they talk about critical thinking, they reference that it involves sound professional judgment applied with high ethical standards and integrity. And they reference that in a broad sense, critical thinking is the art of reflecting on and evaluating your thought process for the purpose of improving it. In our field, critical thinking is a reflective decision-making process that's necessary because every single patient poses a new situation or a new challenge. I've said before that no two procedures or treatments are the same. No two patients are exactly the same. Your patient is your biggest variable, and that's a good thing. That's why, we also talked about the fact that we are technologists because we have to use critical thinking and problem solving, and we approach each patient as a new patient, as something interesting and different, and we don't always do things the same exact way. Rarely ever do we do things the same exact way, unless you work in an outpatient facility, then that might go a little bit better. But if you're in a hospital setting or an inpatient setting, every patient poses a new and unique challenge. Every patient is an individual that has to be cared for in a unique and creative manner. And a patient's individuality and their pathology or disease process can create a situation that requires a quick and inventive response from the radiologic science professional. All right. Critical thinking requires your professional knowledge and experience. Again, as a student, that might not be something that you have right out of the gate, but by working with technologists, you start to build that professional knowledge and experience, and it ends up becoming like a file cabinet in your head where you draw, you can open those drawers and go through the files because you've had a patient like that before, or the last time this situation came up, this is what you did, and you either liked the outcome or maybe you didn't like the outcome, or you were with a tech that did this once and you thought that was really ingenious, so you're going to try it. I mean, you just build your own file system where you can draw on that experience and knowledge. The nature of medical imaging absolutely inherently requires critical thinking skills. Your patient is a huge variable, and you have to constantly critically think and problem solve on your feet. It's not where you can, go talk to the patient and then say, oh, I'll be back in a half an hour, I got out how we're going to do this. You are constantly just thinking on the go. You tend to be on your feet and just kind of running through scenarios in your head trying to figure out what's going to work best. And that's as a tech. As a student, you have the luxury of falling back on that you are a student, and it's more on the tech to come up with different ways. Or maybe the tech says to you, okay, what are we going to do in this situation? Here's what we're presented with. What do you think would work? Or what do you think we should try? Sometimes when they do that to you, it kind of puts you on the spot, but it's a good, because that's what's going to happen to you when you're in the field and working as a technologist. Critical thinking skills are traits that employers expect in a competent radiologic science professional. If you ever look at postings for jobs, a lot of times they will say that there has to be a minimum of 1 year experience or a minimum of 2 years experience, or you have to have worked with these kind of patients before. The reason they do that is because it's a lot of work on a department to get someone brand new right out of the gate. It takes a long time to build that knowledge base, and also the good thing is that when you do apply for those positions, your clinicals count as experience. So when you graduate, you literally have 6 months experience already under your belt, which is a good thing. And not every place requires that. Some places you'll go on clinical sites and they will just really love you as a student, and they'll actually keep their eye out for when you graduate, that they'll want to hire you. They'll tell you, keep in touch. Let us know when you graduate. Let us know when you pass your registry, because we'd love to hire you. So don't think that, oh my gosh, I got to find somewhere to work for a year before I can get hired somewhere. That's not necessarily the case. It's just if you were going to work in a trauma hospital, they would probably require previous experience. If you're going to, with pediatrics, they would probably want you to have some previous experience. It just totally depends on what kind of job you're applying for, how much experience would be required. Critical thinking and patient care, again, each and every patient experience is unique. It requires adaptability and creativity. And if you're not a very creative person or you don't feel that you adapt very well, that's okay, because sometimes you find that when you're in these situations, you do tend to become a little bit more creative and you do adapt a little bit better. So it doesn't mean if you're not a creative person typically, or you don't adapt to things very well, it doesn't mean that you won't be successful. You just have to work a little bit harder and be a little bit more open-minded and tend to draw on your mentors and your colleagues and your peers to see what they do, so that your mind starts thinking a little bit more like that. Again, it warrants reflection and self-assessment for the purpose of improving it. If we go back to the situation I said to you where you go out to get in your car and you're on your way to school and you get in the car and the car won't start. You don't email or call the instructor or call the school and say, I'm not coming in, my car won't start. You probably panic a little bit. You probably call AAA if you can. You call a family member that's a mechanic. Maybe you know what the problem is and you don't have time to deal with it, so you call a classmate and ask if they can pick you up on the way. Or you call an Uber or a Lyft. You do something, but it warrants reflection and self-assessment, so that the next time something like that comes up, you can either say, well, that worked out pretty well because I was, ready to leave a half an hour before. That worked out well for me, so I'm gonna keep doing that where I'm ready to go long before I actually have to go. Or you look at it and go, yeah, that didn't work out so hot, and I was late and I missed a quiz and now I don't know what I'm going to do, so maybe I'll start getting up earlier in the morning since my car's been giving me trouble. You just always self-reflect. I feel like we do that each and every day. It's just now with the field we're going into, it's almost more important to be able to do that, because now it's not just about you, it's about your patient safety, your patient care skills, all of those things that are very important, not only to your employer, but to your patient. And your biggest loyalty, your biggest responsibility is actually to your patient, so you don't want to lose sight of that. They're showing you likely they're in an OR setting or a sterile environment where critical thinking is even more important, because now you've got a patient that is likely under anesthesia. You're trying to image the hip here with this C-arm. It might be in the middle of a surgery case, so you've got to be mindful of sterile field, of the others in the room, trying to do what the doctor wants, and everything is quick. So some situations, trauma situations, the OR, require not only critical thinking and problem solving, but fast critical thinking and problem solving. Critical thinking in learning. Critical thinking requires more than just the simple recollection of knowledge and facts. Learning activities can consist of problem solving, role playing, lab simulations, case studies, situational judgment questions on exams. There's all different kinds of ways that we can assess your critical thinking and problem solving. The learning activities, when they talk about problem solving, we can talk about when you come in from clinicals, maybe the clinical coordinator says, okay, this is a situation I saw when I was out there. This is how, this is what they did. What do you think about that? Or what would you have done if you were in that situation? Role playing, again, when we're in the lab, sometimes we have to role play. We pretend that you're a patient. We pretend you're not able to stand, or we pretend, you're writhing on the table in pain, and you're not really, but you're going to act that out so that we can see how the other student deals with pressure, or how do they deal with the patient that's doing that? What do they say to them? We simulate things in the lab. Case studies are typically when you bring in studies that you've done out on field, things that you've done that you want to share with the class and say, this is what we were presented with, this is what we did. Situational judgment questions on exams. Again, they'll present you with a scenario and say, this is the scenario, this is what you've got, how would you go about dealing with this? What would you do? Would you do something? Would you do nothing? Sometimes they'll give you options of what you would do, and you have to pick what would be the best outcome. Critical thinking skills are taught at higher levels of learning that require skills in the analysis, the application, and the evaluation of the content. There are actually steps that are approached in a specific order to problem solving and critical thinking. And when we look at these are actually found on page 32 in a chart. And they're approached in order. Notice it says that you want to identify and clarify what the problem is. You want to perform an objective analysis of that problem. You want to come up with realistic solutions to the problem. You want to consider all the viable solutions that are involved with the problem and select the best solution to the problem and implement it. Now, it's a little bit different than that table on page 32 as far as the wording. They tell you the first thing you want to do is identify the problem, and then you investigate the problem. Like, what do you know about it? What are all the aspects of it? Then you come up with viable solutions, and then you select the best solution. So you identify and clarify, and then the performing it and the developing is kind of the investigating, and then consider all the solutions and select the best one. Okay, so when you identify and clarify the problem, you pretty much, the first thing you have to do is decide what is the problem. After you decide what the problem is, when you investigate it, a lot of times you have to figure out, like, is it even my problem to solve whatever's going on with the patient? Because if it's not your problem to solve, it doesn't mean you wash your hands of it and walk away. What it means is that you person whose problem it is to solve it, know that there's a problem, and you kind of give them a heads up. I'll give you an example. Let's say you have a patient in the radiology department and you're performing an exam on them, and the exam is probably going to take you 45 minutes to an hour to complete. And you get the patient over on the table, you start to do the exam, and you notice that their IV line is backing up with blood. Notice that the bag is empty and that there's nothing going in, so that there's a backflow of blood into the IV line. Now, what's the problem? Problem is that blood's backing up into the line. Is that your problem to solve? Not necessarily, because we don't usually deal with changing out medications or hanging new meds. So it's not really our problem to solve, but the patient's going to be with us for a lengthy amount of time, and if we don't solve that problem, then it is a possibility that that intravenous line could clot. It might no longer be viable. The patient, I don't know how hard they were to stick. So it's something that needs to be solved, but it's not necessarily your problem. So what do? We notify the nurse on the floor whose patient it is. We let them know, hey, their IV is backing up with blood. This bag of whatever saline or whatever medicine is out. Is there any way you guys could come down and switch that out for me, because this test is going to take me another 30-45 minutes. So you don't just drop the ball when it's not your problem to fix it, but you pass it on and let whoever's problem it is know, so that they can take an active role and take over. At that point, you would be done, assuming they come down and change the medicine out for your patient, and then you continue with the exam. Okay, but sometimes the problems are ours to solve. There's so many examples. We're going to go through some when we talk in the live, but just know that there are specific steps. The first one, you want to identify what the problem is. Then you kind of want to investigate the problem. You want to objectively examine the problem. What do you know about it? What are the considerations that you have to take with that? You want to come up with viable solutions to the problem, and then you want to select the best solution for the patient. As far as critical thinking and learning from that, critical thinking skills are taught in different learning settings. We pretty much start out with the class and lab. You get valuable experience that allows you to develop critical thinking and analysis skills that involve the cognitive and psychomotor learning. And remember that the cognitive and the psychomotor, the only one missing is the affective, the learning domains. So the cognitive and the psychomotor refer to the thinking and the doing of your critical thinking, like thinking about it and then actually enacting it. In the class and the lab setting, that's where you're given the freedom to develop like alternative ideas, to test the ideas that we have come up with, solve the problem without endangering the health of the patient. Okay. The class and lab are the first places that you learn to critically think and problem solve. Very safe environment in the class and lab. If you're wrong, no big deal. If you try something and it doesn't work, no big deal in the class and the lab. But once you get out into the clinical setting, that's where it changes a little bit, because now you're dealing with a real live patient with real issues. So the class and lab allow you to develop your critical thinking and analysis skills, and you can examine a lot of what if or what do we do if. But once you go out onto the clinical setting, now you're talking about real patients with real problems, and then you tend to lean a little bit more on the mentors you have out there, the technologists that are working with you, and kind of pick their brain as to why are we doing this, or why did you do that, or how come we didn't do this. And it goes both ways. They could pick your brain too and say, well, what do you think about this? What do you think we should do? How should we handle this? If this was your patient, what would you have done? All right, and we also have professional standards that should support and define the problem solving and critical thinking skills that are expected in the workplace. Meaning, you still have to abide by safety concerns, ethical issues. Like you can't just go crazy and do whatever you want to do. You still have to make sure that everything operates within the professional standards that are set up for us in the workplace. The critical thinking in the clinical setting, again, critical thinking requires us to thoroughly understand the ethical responsibilities that we have to the patient. Okay, our ethical responsibilities to the patient, remember those are found back of the book. We have the code of ethics. In the code of ethics, we've added an additional code, but those 10 or 11 codes that we agreed to follow when we sit for the registry, and as students you agree to abide by them as well, they pretty much are very broad. To me, they're very much common sense, but I'm not so sure that everybody would agree with that. But it says things like we act in a professional manner, we respond to the patient's needs, we support colleagues, we advance the principal objectives of our profession, we deliver patient care and service restricted by the patient's disease or illness without discriminating against the patient. We practice technology founded upon theoretical knowledge and concepts. We use the equipment appropriately for which they were designed. We assess situations, exercise care and discretion and judgment. We assume responsibility for our actions. We act as an agent through observation and communication to get pertinent information for the physician to aid in the diagnosis and treatment of the patient. We use equipment and accessories, perform services within the accepted standards of practice. We minimize radiation exposure to the patient, to ourselves, and to other members of the team. We practice ethical conduct appropriate to the profession and protect the patient's right to quality care. We respect confidences that are entrusted in the course of our professional practice, respect the patient's right to privacy, and reveal confidential information only as required by law or to protect the welfare of the individual or the community. And we continually strive to improve our knowledge and skills by participating in continuing education activities, professional activities, and sharing our knowledge with colleagues and investigating new aspects of professional practice. And then the 11th one that they added actually has to do with drugs and alcohol, and that saying that we will not necessarily abstain from, well, obviously, yes, from drugs, but that we will be mindful of our consumption of such substances and be mindful of not doing those kind of things before you're going to work. You can't go out on Friday night if you have to work on a Saturday double. You can't go out on Friday night and get lit and be, have to take an Uber home because you're too intoxicated to drive, and then be, expect to get up and work a double on Saturday. Things like you can be brought up on an ethical violation for something as simple as that. A DUI can cause you to lose your license because you're in the healthcare field, so you have to be appropriate with your actions and how you carry yourself, because pretty much what the ARRT and ASRT are saying is that you have to be a prudent practitioner on your own health and safety if we expect you to be that way with the safety and health of others that are not yourself. Clinical setting does offer real world experience. These are real patients with real diseases, real issues, real pain, real nausea, real vomiting, real blood, all of that stuff. So you definitely get immersed in a real world experience, and it requires proficient critical thinking skills. Okay. Just know that, understanding why we do something is key in you making a future decision when the situation is not routine. All right. That's why, modeling technologists that do things that you think do things well or get the job done, that are respected in the field, modeling those kind of behaviors is going to be beneficial to you. You also have to understand that you're going to work with a bunch of different techs, and not everybody is going to do everything the same way. That's usually one of the most frustrating things for a student, is that no two techs do things the same exact way. But you have to remember that everybody has their own little way of doing things. As long as the end result is the same, that's all that really matters. So again, every patient experience is unique and requires adaptive measures in a wide variety of settings. You have to have a complete understanding of the principles of the profession and its practice standards, so that you know that you're operating within those principles and within the practice standards. They also reference you have to learn to work cooperatively and in sync with physicians, physicists, nurses, all the allied health professionals, not only in your department in radiology, but lab, nuke med, MRI, CT, respiratory therapy, all the departments that we have in a facility. You have to be a team player with all of them. As far as the steps, again, this kind of aligns a little bit better with that chart on page 32. You have to identify the problem first, investigate the problem objectively, come up with viable solutions, and then select the best solution and actually implement it, put it into practice. Adaptability, essential component of critical thinking skills. You have to adapt to the situation. The situation is not going to adapt to you. Okay? As far as clinical applications of critical thinking and problem solving, you have to have a thorough understanding and compliance with the ethics of the profession. You have to have complete technical competency, and it requires patient interaction. You have to also be able to explain to the patient what you're doing so that they are able to help you. Most of the time, the patient does want what's best for themselves. They want to help you. They want to be an active member in their own healthcare. They would like to please you and do what you need them to do. It only goes better for them when that's how things play out. So communication, again, is vital. Teamwork is vital. communicating with the patient and with your healthcare workers is vital, and effective communication. Remember, that's important, not just talking to them, but talking effectively. In conclusion, critical thinking skills are vital in our field. Learning occurs at the 3 levels or the domains. Remember, that is the cognitive, the psychomotor, and the affective domain. And they reference that it deals with general knowledge, attitudes and values, and the psychomotor skills. Critical analysis is a 4-step process where we identify the problem, investigate it, come up with different solutions, and then select the best solution. They reference that good critical thinking and problem-solving skills are the marks of a professional imaging technologist and often involve team thinking, and adaptability is the key component. All right, so that kind of brings us to the end of this. I know there are some cases at the end of this chapter. We're actually going to look at those when we do our live, either online live session or our on-ground meeting. We will go through those cases and kind of throw out some different scenarios and see what you guys think as far as how would you critically think and problem solve your way through that. But before then, if you have any questions or comments or any concerns about anything in this chapter, I know it is a little bit different chapter. It's not really giving you necessarily concrete information that you have to know, other than knowing the steps in critical thinking and talking about, working hard to get those things down before you actually go out onto the clinical site. If you have any of those questions, be sure to write those down and I will address them for you. Thank you so much.